Hi everyone. So this video is the continuation of the genetic disorders. In the previous video about the genetic disorders, we were discussed about the Down syndrome and Turner syndrome. But in this video, we are going to discuss about the Klinefelter syndrome and also about the genetic counseling. So that is both asked as a short note or the short essay. So in the Klinefelter syndrome. Uh, the major chromosomal abnormality is 47XXY males, that is extra X chromosomes, which causes hypogonadism and high FSH/LH with the low testosterone. So the characteristic features of the Klinefelter syndrome is there will be infertility because of this extra chromosome that cause the hypogonadism. There will be infertility, that is we have the azoospermia or the oligospermia. Then the small firm testes will be the small phallus, cryptorchidism and hypospadias, gynecomastia, tall and slender body with the long legs. In the Turner, as the name is a short term, that is a short stage, is the most common feature in the Turner syndrome. But in the Klinefelter syndrome, that is a long name. So it is a tall and slender body with the long legs. By this, we have to remember that is tall and slender body is a feature of Klinefelter syndrome, and in the Turner syndrome, we have the short stature. And then also we have the osteoporosis and breast cancer, then motor delay and language difficulties, attention deficit, learning disability, and dyslexia will be there, and also psychosocial or the behavioral problems are the, so these are the features of the Klinefelter syndrome. That is all regarding the Klinefelter syndrome. Then we are going to the one of the short question as the genetic counseling. So the genetic counseling, it is first of all, we have to write the definition of the genetic counseling. It is a communicative process. That is, counseling means a communicative process. So the genetic counseling is a communicative process which deals with the human problems associated with the occurrence or recurrence of the genetic disorders in the family. So it is a communicative process which deals with the human problems associated with the occurrence or recurrence of a genetic disorders in the family. That is, if there is any genetic disorders usually occurred in the family, or if there is any high risk for the recurrence, we have to communicate it with the that is we have to communicate it with the parents of the child, or we communicate with the relatives. So that is about the genetic counseling. Then what all are the aims for the genetic counseling? The aims are to explain the medical facts like diagnosis, disease progress of this condition, and available management options to the family. So that is the most important aim. That is, we have to explain about the diagnosis, disease problems, and available management options to the family. Then also we have to help the family to choose the course of action conductive to financial or the religious status. That is, according to other parents or relatives' financial religious status, we have to help the family to choose the course of action. Then also discuss the risk of recurrence in the relatives also. So these are the aims for the aims of the genetic counseling. Then what are the prerequisite for the genetic counseling? A definitive diagnosis of the condition should be required before we are going to have the genetic counseling, and a pedigree chart of at least 3 generations should be there, and they take necessary clinical, laboratory, and radiological help, including specialized steps. So these are the prerequisites. There is definitive diagnosis of the condition, a pedigree chart of 3 generation, and take necessary clinical, laboratory, radiological help, including specialized steps. So these are the prerequisites for the genetic counseling. Then we have the what are the common conditions where the genetic counseling help us. That is, in the developmental delay or the mental retardation. Another condition is inborn errors of metabolism. Then if there is any unexplained intrauterine deaths or intrauterine demise or stillbirth, if there is any congenital malformations, if there is any ambiguous genitalia, and the conditions like family history of genetic disorders like mucopolysaccharidosis or the Wilson disease, and also about the chromosomal abnormalities, example Down syndrome, and also regarding the myopathies. In all these conditions, the genetic counseling help us. So that is all regarding the genetic counseling. We discussed the first day about the definition is a communicative process, and the aims. There are 3 aims to explain the medical facts like diagnosis and also management option, help the family to choose the course of action depending upon their financial religious status, and also discuss the recurrence of this in the relatives, and key steps of prerequisite that and common conditions where the genetic counseling usually done, and it helps us. So these are all about the genetic disorders. Thank you.